weren't you here? If you have arthritis, you do not want to miss this episode with our special guest, Dr. Karena Wu. And what she's going to do is number one, explain the role of a physical therapist and how they can really help you with arthritis. Number two, what to look for in a physical therapist because they're not all the same. Number three, what would the treatment be like? What works and what has been effective. And we'll also go over what about things like PRP, plasma rich, injections and stem cells, do they work? And that's just part of it. So this is full of so much great information that can really make a difference if you are suffering at all from arthritis. And just a few things about Dr. Wu. You can find out more in the show notes, but she is a board certified clinical specialist in orthopedic physical therapist. She's a fellow of the American Academy of Orthopedic Manual Physical Therapists, and she's the clinical director of active care physical therapy in New York City and Mumbai. So she's been practicing physical therapy for over 24 years now. And she's also the chairman of the New York City Arthritis Foundation Local Leadership Board. And she's a regular expert on television. She's appeared in Good Morning Americans, a regular on the Today Show. And, she has a special interest in arthritis and has just done so much. And she shares some really phenomenal information in this interview. So stay tuned. Welcome, Karena. I'm so happy to have you here on the podcast.
Thanks for having me. I'm so excited to talk about this new topic.
It's so important because so many people have arthritis. And really, people just think, well, I have to live with it. And that's just the way it is. And there isn't, there's not that much I can do, maybe surgeries and things. But in general, people just think, oh, as I get older, I get this and that's it. But there's so much they can do. So I'm just excited because you're the person to talk about this. So thanks again for joining me.
Thanks for having me.
So let's start. Arthritis is the number one cause of disability, and the numbers are growing. Why is this? Why are things, we have a culture where people know about exercise and they know about things. Why is it growing?
So, arthritis is just like a global term, an umbrella term that basically means inflammation in the joints with some inflammation. So, arthritis encompasses a bunch of different conditions like osteoarthritis, which is the one in the bones and the wear and tear, rheumatoid arthritis, gout, fibromyalgia, ankylosing spondylitis. And one of the reasons why arthritis numbers are growing is because we're so much more active. So kids are starting younger in sports. And if you follow any sport, some sports really have a really long time frame in which they're participating. So and if they're playing more than one sport, which a lot of people do, then they really never give themselves a break. And recovery and repair in the process of the workouts and sport participation is super important so that you can help avoid arthritis. There's tons of risk factors for arthritis. They say sometimes it's an unknown cause, sometimes it's genetic, but age can be a factor, family history, obesity on your weight, previous joint injury, wear and tear, or those repetitive motions, and sometimes even medication. So it's really important to be aware of all those things and then to do the things to help try to prevent it.
It's so interesting that you say that about sports. What always amazed me when my kids were in sports, now they're in their 30s, but when they were doing sports, instead of rotating, instead of changing muscle groups, whatever sport they were doing every day, it was so intense that you really didn't have time to rest and to repair because it was just so intense. It was never that way in my day, where whatever you're doing, it was every single day. And it wasn't like a season even. It was like then you have to work, every season. It was just so it's an issue. I don't know why they don't change things.
Well, now they do have like the preconditioning period, and then they're a bit more regimented and aware of like the stretching protocol because they always want strength and power and speed and agility. And you're always going to want to do something, but then like lengthening of your tissues is super important. All the soft tissue release, like getting a massage or using a foam roller, now the massage guns. those aspects of the recovery time are going to help with performance. And so they're much more aware of it because the numbers are growing.
Oh, well, that's good to hear, but it's not good to hear that the numbers are growing. So it's interesting in this community of people who really care about their bone health, it's a major issue because exercise is so important. And when people have pain, oftentimes it just really stops them in their tracks. And what I've found is people don't realize they can see a physical therapist for help. So why don't you share what actually because you've been specializing in this area. So what does the physical therapist, because a lot of times the doctor won't even tell them, well, go to physical therapy, oh, just, take some Advil or do this or that. But, there's such a role for physical therapy here. You want to share what the physical therapist will do?
Right. So physical therapy, we're usually known for our exercises because traditional physical therapy is going to give you exercises. Like we are the kings and queens of stretching and strengthening. But physical therapy encompasses a lot more. If you are a manual therapy specialist, like me and my clinic, Active Care Physical Therapy, we do manual therapy first and foremost. Then we give exercises. That means we're putting hands on, we're doing advanced skilled joint mobilizations, we're doing advanced soft tissue mobilizations. So we're really working around the joint, the bone and the soft tissues around it. And then everyone should be getting exercises. So there's stability exercises. Those are going to help control motion. And those are really critical for good joint health. Then you've got strengthening exercises, which are going to work the bigger mover muscles around the joints. And then you've got flexibility exercises, and those lengthen so that there's less compression in the joints. Physical therapists also will give modalities. So ice and heat, those are easy ones. There's electrical stimulation for pain and for muscle regeneration. There's cupping, there's dry needling, depending on what state you're in. There is the use of lasers and now shockwave therapy. So there's so many things that can be given to a patient based on what a clinic offers and then what the patient needs. So physical therapists will help reduce pain and inflammation. We help maintain muscle strength and range of motion, especially during acute or really painful and inflamed stages. And then as that goes away, then we start progressing you back to general exercises for life and the activities during your daily living, and then for sport specific functions. So there's all these stages of the healing process and phases of rehabilitation that the person will participate in. And then one of the most important things is patient education, because especially in the acute phase, you don't stop fully. That's like actually one of the worst things to do. And again, it depends on the injury and what's going on, right? But we try not to stop fully because our bodies were meant to move. So the more you are immobilized and don't do anything, the more deconditioned that body part is and your whole system. And then you have to get all of that back going. So you want to come in and the therapist will say, hey, this is your issue. Here's what I'm seeing as presentation. Here's where you're weak. Here's where you're tight. Don't do this because blah, blah, blah. And then they'll say, do this because typically it helps with pain reduction and with function. So the physical therapist will teach the patient a lot. And people have to remember that going earlier to the physical therapist will actually help them recover function faster.
Yes, it's so important. Unfortunately, I don't know if you think, I just think physical therapy is so underutilized. Like people don't real too many people think, oh, I'll just live with this. Where if you just went as soon as possible, I agree with you. And something you said I think was really important that you work direct. The manual part of this is essential. Just getting exercises or going online and saying, oh, what are knee exercises? What can I do? That's just not going to do it. And it's sort of, I love the analogy of a door and a hinge. If the hinge is broken or there's something going on with the hinge and you're just moving the door, you're not working on the problem. And that's sort of when the physical therapist who has the manual skills can go in and really see what's going on, get the joint working, and then when the time's right, then add the exercises in the right way. It works and it really, really makes a big difference.
It makes a huge difference. And honestly, we get a lot of clients who get too many exercises and not enough focus on manual. And so they usually kind of give up at a facility because they realize they're doing stuff like the door hinge, the broken door hinge, and it's not really making changes. So many studies have shown manual therapy with exercise after is always more effective because you are loosening up things that needed to be loosened up in order for the muscles and the function to be there. So you always have to do both so that you can restore as much function and get back to quality of life with the least amount of pain or compensation.
Hey, Margie here. High quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store. And in there, you'll see my favorite bone building supplements. So make sure to check it out. And the link will also be in the show notes. So let's get back to the show. So when you're advising people in terms of when they're looking for a physical therapist, what do you tell them?
So I, again, am a manual therapy specialist. So I'm, of course, pro manual therapy. So I always tell patients if they're looking for a therapist, so if it's just the general body parts, the neck, the shoulder, elbows, hips, knees, ankles, then you want looking for an orthopedic physical therapist. And then I ask them to ask for a manual therapist, a manual specialty physical therapist. And I say, ask them how much time they spend doing the manual therapy. Because just doing this is manual therapy because I'm using my hand, but it might not be the most effective manual therapy that could be applied. So ask them how much time they spend. And then I am Maitland trained. So I will refer to my network around the country of other certified orthopedic manual therapists under the MAPS umbrella, the Maitland Australian Physiotherapy Seminars, because we have strong clinical reasoning and it's a very active process where we assess the patient, we pick a priority manual therapy based on the patient's presentation, like what's limited, and then we try it, we mobilize something, and then we get the patient up. And then it will show us as the therapist, and it will actually show the patient if it works because you're using your brain and your hands together. So if you apply something that the patient needed, typically it'll work pretty quickly and the patient will notice a difference. So that's why I love the Maitland approach, because it's so interactive with the patient and it demonstrates to the patient that we're making change to their tissues.
And I think that's so important because nobody wants to just keep going for no reason. You want to make sure that you are making changes, and if something's not effective, and I do, I love the Maitland approach. I think it's fabulous. But it's interesting because you talked about mobilization. I don't know if everybody knows that word, and that differentiates. It's different. It's not manipulation. You want to just share what mobilization is because it's so effective, and a lot of times people aren't getting this, for whatever reason, but I think it's something that is going to really change the treatment. So why don't you just tell people what it is, the mobilization?
So mobilization is movement. Typically, if we're talking about mobility, we're talking about active mobility, like I can move my arm in a circle. So that's me moving it actively. When a physical therapist or a healthcare provider who does hands-on work is doing mobilization, they are doing the work on your tissues. So they are moving something. If they're moving soft tissues like muscles, tendons, even ligaments, then they're moving those tissues and warming them up. Typically, everything is about getting blood flow to an area to loosen it up. If we're doing joint mobilizations or joint movements, we're looking at two bone ends. So like say your radius here and your humerus, and then I'm trying to straighten it like this, but I would be doing the work on the patient. So the patient would be typically lying down passively, at least to start. So they don't really participate. The therapist does everything based on their skill set. And then maybe we might have the patient actively move with us. when we're talking about manipulation, and you should know this, Margie, right? As a physical therapist as well, the new terminology from a healthcare perspective is it's just manipulation. It's just either a thrust manipulation or it's a non-thrust manipulation. So non-thrust manipulation is the mobilization, the oscillation. It's usually a back and forth type of movement. And then the thrust is a one quick like movement that's a small amplitude and a high velocity. So it's what people would typically call like the chiropractic crack. So a physical therapist with advanced manual skills can do thrust manipulation and non-thrust manipulation. But they both work. There's a reasoning to choose one or the other. Most PTs typically will do the non-thrust manipulation or the mobilization. It's gentler, it's very effective, and lots of study shows that, like, say if it's in the neck, a neck manipulation, like the crack, as well as a non-thrust manipulation, the mobilization, the oscillatory one, will have the same effects, the same outcomes.
Yeah, and I think what you're saying, which is so important. Look, I love physical therapists, but the training is not the same. It's just not. And it's really true. And so you really, so a lot of the people in this community are seeing physical therapists who are trained in osteoporosis because they need to have that background to be really safe and give them the appropriate exercises. But if you actually have arthritis, yes, you can see that person, but if you really to deal with your arthritis, it would be great to also, it depends what you're looking for, but this piece of it in conjunction with, or, we really want someone who has that manual therapy skills. And just like you said, because it's very different than just going to, let's say, you have a home care therapist who's seeing patients, they're not going to have the same skills. It's a very big difference. And so, yeah, my degree is I did a master's. So I'm much older, and when I graduated, they didn't have the DPT, so I have a master's degree in orthopedic physical therapy, but all the training in the manual therapy, and it's just so important. So I
Yeah.
couldn't agree with you more.
Well,
Before,
I did a master's therapy too. I mean, master's of physical therapy because I graduated in 2000 when my school only had that. And then an employee inspired me to go back to school to get the doctorate of physical therapy because all the new grads are getting that.
right.
So it just taught me a little bit more. And then it was good as an employer to know what the new grads are coming out with.
Yeah, exactly. And so just before we go on, there were a few things you talked about that maybe not everybody was aware about. You talked about the dry needling and the cupping. So you want to just share a little bit what you've seen, how that can, because it's not something that I guess you've seen now in the health club and you see the athletes with the big marks. So you sort of know about
Yeah.
the cupping, but you want to just share what those two modalities do?
So cupping is the only form of soft tissue mobilization or soft tissue loosening that actually lifts up. It's decompressive. So you are basically using cups, and most people use a hand pump. So it's a pneumatic force that is placed on a tissue depending on what's going on, and it's lifting up. So it's decompressing the area, it's creating space under the skin so that the fluid can move, and it reduces the pain perception, and it actually helps with increasing the soft tissue movement as well as reducing pain. That's what cupping is. It's based off of traditional Chinese medicine, and it's been used for thousands of years. And for Western healthcare providers, so anyone who's not like an acupuncturist, so chiropractors, physical therapists, the way that we, athletic trainers, even the way that we apply it is we don't just stick a cup on and go for the purple colored blood. So Chinese medicine is the purple colored blood means there's a problem in that area. Things are stagnant, again, not moving. And so that's why they go for the dark color and you get the bruises. Western style application, it doesn't necessarily, the intent is not to bruise. The intent is to move, stretch tissues. So you're putting the cup on, and then you can actually have the patient say move. So if a cup was here and it's lifting up, then I can just move, and then I'm moving the tissues underneath, or I can just slide the cup back and forth in different directions to stretch the skin, the connective tissue, and the muscle tissue.
How have your results been? Is that something you use on a regular basis?
Yes, they're great. They are great. They're great for acute issues, like when people are in spasms. You just very gently put the cup on. When people have a lot of inflammation, again, a very gentle application will create space so that the body can help drain that area. You can get more motion in the area, and then typically it'll help reduce their pain perception.
Oh, fantastic. Okay, and the second thing is dry needling. And what's the story in New York City? Is that allowed now by physical therapists? No.
No. So New York State, California, I'm licensed in both. Those two are the toughest ones to get into that because of turf wars, so to speak. So physical therapists cannot dry needle in New York, but the use of dry needling is again based on Chinese acupuncture. It is going into a specific tight tissue. So the needle gets inserted and it's still pretty superficial on occasion, but then it can go deep into the tissue, into the muscle tissue. It is going to help release the fascial bands, those things that you call knots. You know, everyone's got a knot in their upper track here in their shoulder. That really tough spot, and usually it's a very tender spot, is the muscle fibers are all kind of clumped together and they're all stuck together. So they're adhesed together. And so the needle going in there can actually help it just sort of relax. I always use food analogy. So it's like the hot spaghetti noodles. When you pour it out of the water into the colander, your muscles are supposed to slide like the noodles, like when they're fresh out of the hot water. Then when you go back for your second serving and the noodles are sitting in the colander, they're cool and they're in the sink, and you go to pick it up and it's like a giant mess of noodles all clumped together. That's your fascial adhesion. That's the stuff that's like in the muscle tissue. So dry needling helps release those honestly way better than a physical therapist does, because we can only like dig in with our fingers or tools like the Graston instruments, Graston technique instruments, or we use a cup, but we can't really get in. So physical therapists or acupuncturists who do dry needling, the needle goes into that area. There's a little electric release also from the needle insertion, and then they kind of poke around and it can actually just release those adhesions. It's great. Great. Game changer.
Yeah, I have to say, since I'm not actively practicing physical therapy, I don't know now what the law is in New Jersey. Do you know? That's where I live. If it's
So in New Jersey, physical therapists used to be able to do it, and then they took, because acupuncturists fought that because of the turf wars, you know, taking their business away. Then they took it away from New Jersey physical therapists, so far as I know, a long time ago. And they said, if you still want to practice, you just wouldn't be covered under your insurance. So God forbid someone goes after you, then you're in really big trouble. But I'm not sure if it came back around, if they have lobbied enough to get New Jersey physical therapists to allow it.
Yeah, because I'm thinking back in around 2010 when I was working with patients, it was allowed, but then it stopped. Then it quickly, like places that were really effective and having great results, they had to stop it. So yeah, very interesting.
There's
Um,
actually another therapy called blood flow restriction training, which has been around forever and then has just recently sort of blossomed with like companies making the cuffs and things like that. That is amazing for people with arthritis or with tendon issues, because it's basically like a tourniquet training. It cuts off the venous blood return. So it doesn't cut off arterial blood flow in, because that would be bad. It just cuts off the veins' ability to exit blood back towards the heart. And so you do exercises typically with lighter weight, and you do them with a very specific dosage. So research shows 3 sets of 30 reps, or 1 set of 30 reps and 3 sets of 15 reps at a lighter rate has almost the same effect as high resistance training. So the reason why it's great for people with arthritis is because you can do exercise without irritating your joint or your tissue as much. So it's great for elderly people, great for arthritic joints, and it helps increase muscle strength recovery in 3 to 5 weeks versus the normal 4 to 6 up to 8 weeks.
I'm such a big fan of this because a lot of people, especially in the osteoporosis world, where we're trying to increase bone density and we need that resistance, but yet people, due to pain or whatever reason, can't do the weight that really is going to make the big difference. But with the straps and with the blood flow restriction, they can. I actually had an episode on that. It's not traditionally used for osteoporosis, but I think it should be. I think it's so underutilized as well. Is that something you do in your clinic?
Yes, so long as there's no other issues with like blood flow or anything like that where you can't get that sort of compression, it's great to help recover. So we use it for our young patients, like we have a lot of patients in their 20s, and we use it for our patients who are elderly. Again, clearing any other comorbidities. It's great because it really does increase strength faster, which helps with your bone density, helps with your pain, helps with the inflammation. It's so good. It's basically turning on your hormonal system so that your body can build better.
Yeah, it sort of tricks the body is what it does.
It does, it does.
But
And
it works.
it's interesting because you think it's not that hard, but when you do 30 repetitions times 3, that's 90 reps. So that's a lot, number 1. But when you even with a lighter weight, you start and you're like, "Oh, this is easy." And then by like repetition 15, you're like, "Okay, wait, hold on. I'm only halfway." And then you're like slowing down. It's very high intensity exercise. That's why you have to make sure there's no heart issues or blood vessel issues before you use it.
Yeah, and I'm such a big believer of doing it with a physical therapist who's gonna make sure, because there are people that, work with trainers with this, but yeah, you really have to do it properly to make sure that there aren't any other issues and just evaluate the person beforehand. But I think it's something people don't know about, and it's a way that even if you have the arthritis, if you have pain, that you can gain strength and improve your bones. I just think it's a win-win. So I
The other thing I want to mention about strength training is because I see some physical therapists will do this, and then definitely, I don't want to say definitely, but personal trainers can do this as well. You have to make sure the individual muscles around a joint are strong before you can function the whole leg or the whole limb. So, like, say something like your knee. I actually have knee arthritis. So, it's important to keep your glutes really strong, which is the butt, which is the hip joint. And I have to do hip strengthening exercises where the leg goes forwards, backwards, outside, inside, and rotates. That's all hip stuff. Then I got to do the knee, which is straightening and bending the knee. And then I got to do the calf. But in order for me to just squat, I don't use one muscle only. And what happens is I find people get progressed to functional exercises faster. And then when you individually muscle test them, they're still a little weak, which is why either their baseline inflammation gets irritated to like with a lot of recurrence, or they are not profoundly strong and their quality of life. They're not as close to 100% as possible. They're more like staying around 90% because the individual muscles aren't strong. So it's always important to make sure that you've got both going. It's a team effort.
It's such a good point, and that's sort of why I always say, again, any exercise is important, and I'm a big believer and have all sorts of exercise programs online for people. But the best thing you could possibly do is see a physical therapist first and just make sure you don't have any of those imbalances so that when you do try to do the squats and other things, you're doing it properly without putting undue force because one area is weaker than another. So I think that's such a good point that you brought up. And in terms of prevention, as people are getting older and they're doing more exercises, we all want to stay active, we all want to lift and do. But are there preventative things that people can do so that they don't do damage to their joints in terms of both, for so that they can help reduce, arthritis?
Conservatively, if you don't have arthritis, the best balance is being stable. So those are the deep stabilizer muscles. Those control little motions in between the bones that you might not have voluntary control over per se. Then there's the strengthening or power of the bigger muscles. So again, you got deep stabilizer muscles and you got the big mover muscles, and you have to have both of those strong. You have to have endurance, which is the ability of the muscles to work over time. And then you have to have flexibility. So flexibility will be the lengthening of the tissues, things that allow you to move and stretch without damaging or tearing tissues or irritating the joint. So if you didn't have arthritis, the balance between that is crucial. You also need to be very well hydrated because 75% of the population is dehydrated. And you need to make sure you have a nice balanced diet, right? We can't have the bad foods, all the processed foods that have bad responses in the body. So that would be if you're not in the category of having, say, osteoarthritis or anything like that, or even, the systemic rheumatoid arthritis. If you did have osteoarthritis or that, then you can do other alternative therapies. So physical therapists would help with you with your condition, but there are limits to it. Things like regenerative medicine, like PRP and stem cells, those are really good at helping to almost reverse things. I can speak from my experience. I had severe arthritis in my left knee. I had surgery. We thought it was a meniscal tear. My surgeon went in. He basically cleaned it out. It was down to the bone under my kneecap, and then, which is a grade 4, well, that's the worst. Then I had grade 3, which is really bad too, under the inside part of my femur or my thigh bone. So we cleaned it out. I will admit I didn't do as good a physical therapy stuff as I should have. So the muscles never really got strong. And then I had extra movement in the joint every time I would try to work out. I would try to squat and it was just not right. So I do like baby squats and I was like, okay, that's all I can go, which really sucked. And then I ended up getting stem cells. So stem cells are pulling those very specific regenerative cells from your bone marrow. They pull it from your pelvis, they clean it all up, and then they re-inject it. And they injected it into all the areas I had problems, and it was a game changer. So that was 2 years ago. I just got an MRI this last year for my platelet-rich plasma, my PRP booster. So platelet-rich plasma is pulling, they call it the vampire treatment. So you draw blood, your own blood, and then you spin it out and you collect the platelets, which again are the regenerative cells, and then they inject those into the problem spots. And my knee MRI from 2 years ago to now was almost completely different. I had so much inflammation in my bones as well as the cartilage covering. So people also don't realize that with osteoarthritis, it's not just the bone covering that gets irritated and worn down. It's actually the bone below that can get really irritated. And that's what was showing on my MRI. So the bone itself, like the end of the whole bone, was super inflamed and had fluid in it. And so it shows white on an MRI, on a specific MRI. That's the edema, the inflammation. And then I just reviewed the films last week with my doctor, and he was like, your knee looks great. And my whole MRI, again, a very specific picture, was like all black. And black on that particular MRI means the tissue is healthy. And I was like, holy crap. I was like, this is amazing.
Wow. So
So
what do people know about this? Because who should they see? This is, I mean, that's a phenomenal story. And so many people are suffering and they don't know what to do and they're afraid. People are very afraid of injections and afraid. Oh, so share some more about this. That's really so exciting.
So you want to find a regenerative specialist. So those are the doctors that are using stem cells from themselves or platelet-rich plasma PRP. You want to make sure that they work the specific body part because sometimes they'll specialize only like say hips and knees, or they'll do shoulders and elbows. They'll do the upper arm versus like the lower body. And then you want to have a video consult with them. And I always usually get more than one opinion. Most oftentimes they're willing to do a consult either for free or it can get covered under insurance. There are companies like, so I went to a company called Regenix, which is around the country, but so I'm New York City based, but I specifically fly to Florida because the doctor is also a friend of mine. And I love his bedside manner and I love how thorough he is because he injects everything. My knee is like huge afterwards, but he goes for the tissues that are damaged and then also knows the other tissues might need a little boost. So he'll also inject those. And that I think is a very big difference. So when I got my PRP after my surgery, my surgeon did it in his office and he pulled out the platelets and then he just stuck the needle in the joint and squirted it in and pulled it out and done. And I didn't think it really helped that much because if you do it like that, then you're hoping, fingers crossed, that the platelets are going to work on all the parts that are wrong in the joint. But they're all swimming around inside. And I said, how do you know if they're actually going to hit my problem tissues? And they're like, oh, and a doctor friend of mine has said this. They're like, oh, it'll know. And I'm like, okay, that's kind of, you know, we're again, fingers crossed. But the way that Regenix does it, and they've got a 20-year history of research, they have done studies where they know that if they lay the cells down on the part of the knee that I had a problem with, if they just waited 30 minutes before they bent my knee, they knew it wouldn't migrate or move off of that area. So again, depending on the clinician you see and the facility they're working, if they're super thorough and they, no joke, prick you everywhere with the stuff, you have a much better chance of healing. It's like being more holistic than just like too local and targeted, even in the one singular joint. Does that make sense?
Yeah, it's very interesting. So most people will see their local orthopedic, most people. So is this something it's an orthopedic surgeon who's doing this or
Um, they can be orthopedic surgeons that have maybe changed to regenerative medicine because that's a
Mm.
very different specialty. My guy has always been a non-surgical provider, non-surgical doctor. So when they say non-surgical, they still will prick you with a needle. So that's considered invasive, but it's not cutting you open and doing the change of tissue stuff.
So the orthopedic surgeons, when they, because a lot of times they say they'll use just gel. Like, what are they talking about when they're saying, let's inject some gel? You
So
know,
the hyaluronic acid is the gel lubricant. They usually come in a series of 3, and those can work, but basically you're putting the gel in, and I've not had them done, but you putting the gel in, and it's basically lubricating you like the Tin Man. Whereas the regenerative medicine treatment that I got is very site specific. So, I mean, he poked into my meniscus, the cartilage rings inside the joint of the knee. He poked into the ACL, which is a ligament that's all the way inside, right smack in the middle. He poked into the ligaments that are on the outside of the joint. He also went into the bone of the kneecap, into the bone of my thigh bone. Like he hit everything. And it made a big difference because, again, you're giving every tissue a chance to either boost its health. As we age, we also kind of wear down just everywhere, but it also fixed the things that were wrong.
ah, I love that. And what have you seen with your patients who've had these kind of
Uh,
procedures?
I see so it's not really covered by insurance. Okay. I'm actually trying to get mine covered, but I just paid out of pocket because I knew it worked and I wanted to get it done. So a lot of times it's a sticker shock thing because it's typically not covered still. It's elective. It means like surgery is not a guarantee that it's going to work. And then these regenerative medicines are not also guarantees. Like there could be variable outcomes. So most oftentimes people find out it's usually a couple to a few $1,000s and they're like, whoa. But I was just touting the benefits of it from my recent procedure to a 28-year-old patient who's got a very bad low back since she was 16 years of age. Okay. And this is basic musculoskeletal stuff, not arthritic. And I was like, you really should consider this because we've worked with her for like 2 years and her back muscles can only get so strong because of the changes secondary to the long-standing issue with her spine. So that's why I said physical therapy still has some limitations, and that's why dry needling from acupuncturists or whoever helps. Regenerative medicine helps, and then we continue our, you know, rehab goals to get them as close to 100% as possible.
So did she go?
She's considering it. Her other option was a muscle stim device that's implanted that was $25,000 out of pocket. So she's like, yeah, I guess that might be different if it's only like a few $1,000s. And I'm like, I'm telling you, you would need it. You're using your own cells to heal. And it really can help a lot. So when it comes to arthritis stuff, like from a bone end perspective, If you have enough bone loss or irritation in the joint and pain and it never goes away, that's usually when you're heading towards total joint replacements, right? So before that, if you want to try to prolong and not go for the joint replacement, then the regenerative medicine can really help with kind of boosting your tissues, and you'll see how long it carries you, because you do have to be generally fit, right? Because they will measure your cells to see how good they are operating before they re-inject them back into you.
So interesting and that you had such positive experiences yourself. That's really exciting.
I've heard positive experiences from other people as well. I just happen to have personally gone through it. I always say I'm like doing my market research on myself so I can share it with others. But when you truly experience it, it's you understand the value of it. And that's why the value of that healthcare cost is palatable. I'll continue working so that I can pay it off, because again, I don't want to have my joint replaced yet. Not yet.
Yeah, and with your background, you have such a good understanding, so you know what's going on, then you can do the physical therapy after. Perfect. In terms of something I think so important we didn't really touch on is balance. You know, a lot of times you wanna just share why that's so important when it comes to arthritis, when it comes to, issues with their joints?
Safety, right? So as we get older, there's a higher risk for falls. When you have arthritis and your muscles weak, maybe your joint is stiff, you don't have the reflexive ability, that quick movement to be able to, withstand a slip or trip or something like that. So we always want to make sure that we don't have more issues, so that, we fall and then possibly break a bone or damage another part of the body. So balance is important, because if you're ambulatory, which means you're walking around, we don't want to slip and fall. You don't want to slip and fall when it's a nice sunny day and it's flat level ground and there's no one around you, because it has happened to people. It just something catches, or they, lose their balance. So the most important thing about that is you have to work your balance systems. Those are your eyes. So eyes need to get checked, your inner ears, and then your somatosensory, or which is your touch sensation. So proprioception, if you ever heard the term, proprioception is your body's awareness of itself in space. So you have three systems: the eyes, the inner ears, and then your touch sensation. Those are your balance systems. And you always want to make sure that those are working appropriately, so that you can go through your daily routine without any issues.
So important. So the someone's listening and they're thinking, I probably should see a physical therapist. How often, just so they get a basic idea, when you're working with someone, like how often do you usually see them during the week? What have you found to be most effective?
So typically, if someone's coming in and they need to make changes, you have to do a minimum of twice a week. Ideal, if you're local to the area, it's in your schedule, 3 times a week will typically get you progressing faster. Again, if there's tissue timelines on things like the healing timeline, you can't really force those to be done faster. But people who attend physical therapy 3 times a week usually feel better faster, regain function faster, because they're under the care and supervision of the therapist. So we're helping with exercises, we're helping with calming the system down, getting rid of the pain and the inflammation. And then again, the do's and the don'ts are super important. So 2 to 3 times a week, usually you start with 4 to 6 weeks. Every session should have a reassessment. So when someone comes in, I'm always like, how are you today? And then they'll tell me how they are. And then I'm finding out how they were, say, from the last visit. So I'm always kind of reassessing or reevaluating how their progress is going. Then you have formal assessments, usually around the 4 week mark or like every 10 visits, so that we can really document changes. We see 10% improvement. I see a 1 point change in their muscle, activation, things like that. Those are objective measurements that physical therapists use. So that helps guide us, in addition to what the patient's reporting to us about how we are making change.
Love that. In terms of, you know, well, actually tell people, because you see people in New York City. Tell people who are listening, because people can see you. So tell us, why don't you just share a little bit about how people can get in contact with you and who you're able to see?
Yes. So my office is an outpatient orthopedic practice. We are manual therapy specialists. We also use Pilates for rehab. We do all sorts of hands-on stuff. So we do the hands application. We do Graston technique, which is the instrument assisted soft tissue mobilization. That's the use of metal instruments typically on the soft tissues. We do cupping. We do functional training. We do sport specific stuff. So my company's name is Active Care Physical Therapy. We are located on 38th Street between 5th and 6th Avenue, so right in Midtown. And we are open Monday through Saturday. We do all one-on-one appointments. So we do evals for like 1 hour. That usually includes a little bit of treatment. And then we do follow-ups are scheduled every half hour. Patients usually hear about the full hour, but they get one-on-one time with the therapist. So we treat even some children, like some like 7, 8, 9-year-olds, all the way to I just had a return of a patient who's 91 who had balance issues. And within one session, just showing him the home exercise program, and he's arthritic all over. I showed him the exercises which were strengthening based. So we did one set and then we went for the walk because that was our tests on how he performs pre and post. And he was able to take a longer step. He felt more balanced. He walked more confidently. And I was like, you need strength. And then I had to gently reprimand him for not using his insurance more proactively. So reactively, we always get patients after an injury or after someone who's been complaining about something for too long, and then the pain just kind of doesn't really go away, or they realize that they're crooked and moving funny. So if your insurance covers it, or if you do self-pay, it's always worth it to keep your body healthy so that you don't get to that state and then have to fix problems.
I couldn't agree more. It would be so frustrating when I was working with patients and like knowing this could have been prevented if you came in day one, and now it's going to take months to recuperate because you were just trying, oh, I can handle this, or oh, it's not a big deal. So yeah, so baby yourself and get the treatment because it can make such a big difference. And what about telehealth? What's the deal on that? Who can see you for telehealth?
So they are still allowing telehealth. I just got an email blast from a company that's, from what I pulled from it, they're still allowing for telehealth. Telehealth, we can show you how to do exercises correctly. So you get the supervision of us watching you on the video. And we also show you how to do self massage or self releases and even some self joint mobilizations. Obviously not as good as when someone skilled is doing it on you, but during the pandemic, it worked so well that our patients were really good with doing their home exercise program, that we didn't have that much request for telehealth, which was good and bad for the business, right? So we do in person, we do telehealth. My office also has an acupuncturist who is someone who rents space and helps treat some of our patients. And then we also have a Pilates instructor and personal trainer, because some patients, when they've gone through the rehab process, when they want to work with someone who's a little bit more aware of the medical condition, it's great to have someone, when you collaborate with those types of providers, it's really good for the patients, because sometimes they'll flare themselves off, even if they're getting better, they just have something going on in life, and then they'll come back in for like a session or two of PT so we can fix them up better, and then they go back to the one-on-one, personal training or Pilates exercise. It's great.
And do the people have to live in New York? What's the rules with the telehealth?
No, they don't have to live in New York, so far as I know. No.
Okay, great,
Yeah.
because we have a community, worldwide community, who listens to this podcast.
Yes.
So, oh, that's great. That's so wonderful. And to me, that's really the next best thing. If you can't see someone who's knowledgeable and knows what to do, then at least get the guidance through telehealth. I think that's huge. And that did happen. Your story that you said with the pandemic, from so many therapists who said, I would never have thought I could be so effective. And they were really shocked they were really shocked at what was capable with the right instructions and being sort of forced to do it this way. They were surprised at the results. So I think that's so interesting.
You know, it's also really interesting because I interviewed, physical therapy staff during the pandemic because I lost some, and then you try to hire back. PTs who are working at other clinics had a really difficult time getting telehealth because most people, once you feel about 80% or so, you kind of like good, right? So it's like a B average. Like you can walk around, you can do the most of the things in your life, and it's not really a problem. And people get okay with that. We're always shooting for like 100%. And so people wouldn't really participate because they're like, no, it's fine. I'll just do the exercise you gave me and I can live with, a 3, 4 out of 10 on pain. And we're like, yes, but wouldn't you rather have a 0 on 10 on pain? you know?
It's
But
true.
during
And I
the pandemic,
always
people
can't
were like,
believe.
"Yeah, it's okay, fine, it's fine, whatever. We got other life stresses." So that's where we always are telling our patients, we're like, "We get that you're like 85% you can lift your arm and then it doesn't hurt as much as maybe like a 2 out of 10 at worst, but we're like, wouldn't you rather get to like 100% and nothing, And they're like, "Yeah, I mean, sure, but, now my other priorities in life take precedence."
It always amazes me. I just am always amazed, like, they'll tell me, "Oh, yeah, 10 year," they like, "Get help." But people, for some reason, it just seems that people don't realize that there is help, and the help can make such a big difference.
But it's because of the costs. That's why.
Yeah,
Oh,
and a lot of times it is covered by insurance, and sometimes it isn't, so, yeah,
yes.
very,
But
very.
you know what? Honestly, as a small business owner, the competition's fierce. There's so many physical therapy companies around. There's the big chains. I'm a single practice. We're willing to work with someone because I'd rather get someone in and give them quality care and have a successful outcome. A physical therapy office typically is always willing to work with a patient. So you just have to keep your ears open and be open to the conversation because sometimes people get turned off and then they just ghost you and then we're like what happened, and like I said, they put their health on the back burner and you don't realize that it's going to come back and bite you in the butt because as you get older, I'm just over 50, things just pop up. So you start to see all the things, and then you're like, "How did I? What? When do I get, arthritis? It just popped up in when I was 48."
And the arthritis really can really impede your program and just your whole life. So all the wonderful things you're trying to do, all of a sudden you can't, you just have trouble because of pain. And the good news is that there's so much that can be done. That's why I love the work that you're doing and that you've gotten so involved with arthritis and organizations. And you've really just done so much to help people. I just think it's wonderful. But you also said for people, if they did want to see you, want to just share about the happy bones that you told me about?
Oh, so if you did wanted to come into active care physical therapy, I treat on a limited basis because I am a business owner and I do travel for work. But I do have a staff of 3 physical therapists here. And if you just mention Happy Bones, we'll give you 20% off our services. So if you're out of pocket and you're paying for physical therapy services, but we also have laser, we have kinesiology tape, we have a Fit 3D body scan that can actually give you your body composition, shows you your posture and balance in space. We do cupping application. We do the instruments for the soft tissues. We do services like say you didn't want to come in for the full physical therapy eval for whatever reason, you can just come in for a cupping session and get your tissues loosened up. And usually, every physical therapist has a habit of giving patients instructions. It's a bad habit that we have. So we're always like, don't do this, do this. It sounds like you have this. So you can always get some level of treatment. And we'd be happy to work with you guys. Just mention Happy Bones and we'll give you 20% off.
Oh, well, thanks. So what advice do you want to leave everybody with? Did we miss anything important? But is there anything you just want to leave people with? Because as I said, people who listen are, most people are 50 and over, and a lot of people do have issues with their joint and arthritis. And so what would be, what do you want to leave everybody with?
I would say seek a healthcare provider sooner rather than later if you notice something wrong. That is very important because the sooner you come in after something starts, the more rapid your progression should be. The longer it is, the longer you've had it, the more compensations you have, the more the body's adapted to that new state. And then you're asking the physical therapist to fix it like in a session or two. So come in earlier, make sure that you get the best quality care. Ask your therapist questions. They should be able to answer you, they should be able to be accessible. So you want to make sure you're very aware of what to do, what not to do, and what exercises are appropriate, how long it'll take for you to get better. We set goals and we set the goals with the patient. It's not just like I see you and then I think you should come in for 8 weeks. It's like, oh, you travel around the world for work and you have 3 kids at home, which one's a baby. Oh, and you're a single parent. Then I'm like, okay, fine. Let's realistically set some goals where you are going to commit to doing this, and then we will commit to doing this, and we try to adjust for each patient. So it's very tailored. And just know that there are plenty of therapies, both conservative and a little invasive, that you can do to either help manage and keep it at bay, or you can help try to reverse your condition. So, again, seek out help to ask. Knowledge is key, knowledge is power. And arthritis is not the end all sentence. You can actually change your state. And working with the Arthritis Foundation, there are big studies that show the use of some medications for like systemic arthritis, like the rheumatoid arthritis, that are showing little to no activity of the disease. So participating with your local arthritis foundations. So I'm in New York City. We have the New York City Arthritis Foundation. If you participate in those, you get resources, you get support, you get a wealth of knowledge about what is coming up. And there's a ton of advances. So that's one of the reasons why I work with the Arthritis Foundation, is because they're making advances. I personally have arthritis and I treat patients with arthritis. So supporting them to help us is key. So that is a resource that you should choose to gain knowledge on how to handle your condition.
You know, it's so interesting because that's what I always say, knowledge is power. That's something I say all the time, and I couldn't agree more. And there's so much hope. I think that's the message, that don't settle, get help because, why not live your best life? And I think you've given us so much inspiration and really just so much good advice. So thank you so much. We'll have all the links to your clinic and everything else in the show notes. And I just thank you so much for joining me today.
Thank you for having me. I'm so happy I was able to share about this topic.
I hope you enjoyed my interview with Dr. Wu as much as I did and have a better understanding of things that can be done to help arthritis and how a physical therapist can be part of the solution. All the links that Dr. Wu talked about will be in the show notes. And make sure, if this is something that you're dealing with, to prioritize yourself and get the appropriate treatment. And please share this with anyone you think can benefit. And just thank you for tuning in. And I look forward to seeing you on the next episode.